Perfect.
We are
Thank
now.
you. Perfect. Thank you.
So, good morning, everyone. My name is Dewana Graham, and I am First Vice President for the Phi Eta Omega chapter of Alpha Kappa Alpha Sorority Incorporated. And good morning, and thank you so much for joining us. To open our conversation, I would like to introduce our president, Elizabeth Tillman, who will deliver some welcome remarks, and then we will get started.
Great. Good morning, everyone. Thank you, Dewana. Good morning, good morning, good morning. Happy Saturday. I am Liz Nolly Tillman, the president of the Phi Eta Omega chapter of Alpha Kappa Alpha Sorority Incorporated. And it is so wonderful to see so many of you on with us this morning. For those who may not know a lot about Alpha Kappa Alpha, we are dedicated to implementing programs of service that enhance the social, economic, and educational well-being of the local, national, and international communities in which we serve. Here at Phi Eta Omega, programs are the heart of what we do, specifically as we serve the community of Scotch Plains and Fanwood and Greater Union County in New Jersey. Since our chartering in 1999, the size and the scope of the services that we provide to our community has grown significantly in support of our efforts to improve the quality of life for all mankind, in keeping with Alpha Kappa Alpha's mission to be of service to all mankind. It is really my true honor to welcome you all here this morning on behalf of our chapter to today's important virtual conversation on centering Black maternal health and empowering change. On a personal note, I'm very excited that we decided to do this forum and have the two experts that we have here today. I know Black maternal health is something that impacts a lot of us as Black women. And for many of us, it's difficult to talk about it. And we don't even know that our sisters are going through something or struggling or facing certain issues or being impacted by certain issues, conditions, or illnesses or things that impact us disproportionately until we share our stories and share our testimonies with others. So I'm just so delighted that we have put together this conversation today. And in that note, I want to thank our featured speakers. We have our very own Alpha Kappa Alpha sorority sister, Christine Ivory of Rho Theta Omega chapter in Philadelphia, joining us, and our very own Phi Eta Omega member, Trayshawn Powell, who are two experts in this area. And I just want to thank them in advance for sharing their expertise and their insights with us today. And I want to thank our first vice president and program chairman, Dewana Graham, and the entire program committee, especially the Target 2 Women's Health Subcommittee, for all of their hard work in putting together today's program. We're so delighted to see so many of our chapter members and guests from across the community here this morning. And we invite you all to follow us on Facebook and Instagram to stay posted about our upcoming activities, including a couple of things that are happening right now. We are focused on getting out the vote in time for the upcoming June primary happening here in New Jersey. So you can see more about that. There's links and information on our social media pages where you can go and check your status and register to vote or help somebody else do the same. You're also welcome to join our team as we will be participating in the May 20th Relay for Life and Scotch Plains event that will be benefiting the American Cancer Society. I will drop the link in the chat to that in case you want to join us or support us. And we also encourage you to support the Jimmy Express team and the Tackle Sickle Cell Walk that will be hosted by the Embrace Kids Foundation on May the 22nd. That's not right. It's that Sunday. Help me, somebody, help me, sorors. On May the 29th. So I will drop the link to both of those walks and both of those team opportunities. If you'd like to join us, please do. So without any further ado, I will turn today's program over to our first vice president and program chair, Miss Dewana Graham. Dewana, take it away.
Thank you, Madam President. And thank you again, everyone, for joining us for this critically important conversation. And I use critically purposefully because there is a real crisis when it comes to caring for Black women, Black mothers, Black infants and children. We know that there's a disproportionate impact as it relates to the mortality rates of Black mothers when you compare that to white women. CDC data from 2020 tells us that for every 100,000 live births, 55 Black women die. And some might say that as a percentage, this is a very small number. For white women, however, that number is just 18. When you narrow that lens to focus in on New Jersey, Black women are 7 times more likely to die from pregnancy-related complications than white women. And the reasons for these disparities are multifaceted, yet can be summarized as consistent and pervasive inequities, whether that be about inequities in access or policies and practices that institutionalize and perpetuate these inequities. So we are extremely fortunate to have 2 experts in the field of Black maternal health with us this morning to talk not just about the problem and about the data, but to really help us develop the knowledge and skills that we need to affect change and become effective advocates for ourselves and for Black women as a whole. So first, we have Ms. Christine Ivory. Christine is a prematurity prevention initiative project director for the Southern New Jersey Perinatal Cooperative. She is dedicated to addressing and mitigating issues of Black infant and maternal mortality. Her passion is to help all walks of life through disease and disparity prevention, as well as making an impact in the communities she serves. She secures successful implementation of the program objectives and cultivates networks with maternal healthcare stakeholders to effectively address barriers that affect birth outcomes. Presently, she serves as chair of Sisters in Public Health Philadelphia, in the Philadelphia chapter, past immediate president of the Public Health Young Leaders Association in Philadelphia, and community health planning and policy development section counselor for the American Public Health Association. She is a proud member of the American Public Health Association, Philadelphia's section on public health and preventive medicine, Drexel University Center for Black Culture Advisory Board, the Greater Philadelphia Norfolk State Alumni Chapter, and a member of Alpha Kappa Alpha Sorority Incorporated. Christine holds a bachelor's degree in exercise science, kinesiotherapy from Norfolk State University, a master's degree from Drexel University in public health, and a health education specialist certificate. So please join me in welcoming Christine. Second, we also have Mrs. Trayshawn Powell. Trayshawn is a known statewide leader in human fundamental rights, having over 2 decades of experience in nonprofit organization and government. Through her own near-death pregnancy experience, she has been a longstanding advocate for equitable and quality maternal health for birthing people of color nationwide. Presently, Trayshawn is the Vice President of Programs with the New Jersey Family Planning League, a nonprofit organization committed to providing access to quality family planning and related health services for all residents of New Jersey who need them, regardless of identity, income, and/or insurance status. Trayshawn is very passionate about issues that impact women with a primary focus on Black maternal health. She has advocated, amplified, and illustrated these issues within New Jersey through the National Preeclampsia Foundation signature event, the Promise Walk, since 2013, raising over $10,000 and hosting biannual fundraising events. She is currently a member of the Preeclampsia Foundation's Racial Disparities Task Force, certified patient family partner with Mama's Voice, and uses her personal experience to move the work forward to improve outcomes of the maternal mortality health crisis. A New Jersey native, Trayshawn earned her Bachelor's of Arts degree from Stockton University and Master's of Arts from Thomas Edison University. She too is a proud member of Alpha Kappa Alpha Sorority Incorporated. Trayshawn is happily married to her wonderful husband of over 10 years, and they are proud parents of 2 wonderful and energetic children. So as you can see from their backgrounds, we have 2 really phenomenal people here to talk with us today. So we're going to start the conversation with Christine, and then we're going to segue to really a candid conversation between Christine and Trayshawn, and then we will allow some time at the end to take questions from you in the audience. So we encourage you, as we hear the dialogue and hear the conversation, please drop your questions in the chat and we will circle back to those at the end. So Christine, I turn it over to you.
Good morning, everyone, and thank you so much for a warm welcome. I'm going to work on sharing my screen right now. So first, I want to say thank you for being brought to the table for this important and, as Sora Dewana just mentioned, such a critical conversation. I want to say thank you to President Tillman, Sora Dewana, and Sora Trayshawn for inviting me for this conversation. My name is Christine Ivory. I'm the project director of the Prematurity Prevention Initiative. And I'll talk about the Prematurity Prevention Initiative a little bit towards the end, but I do want to highlight that we work underneath the agency of the Southern New Jersey Perinatal Cooperative, which has been serving mothers, babies, families at large since the 80s. We're actually coming up on 40 years. And so as we're talking today and as we were gathering information on what we wanted to discuss, we entitled this presentation to be Centering Black Maternal Health and Empowering Change. And so Sora Dewana just gave us a really great landscape as to what it's looking like right now in the state of New Jersey. And we'll be diving into those numbers, those statistics, but we'll also talk about how to move forward with some strategies for empowering change in our own communities. So before we get started today, I want to just start with a story. Many of you all may have heard this story, and if you haven't, I just urge you to take a moment to look a little bit deeper into her story after we finish out today. But we'll talk about Kira Johnson's story. Kira Johnson, Black mother who died from maternal death and maternal experience that went very wrong. So I won't give too much away. I want to play a 2-minute video, and then we'll come back together. And please let me know that you can all hear this. Give me a thumbs up.
When Kira and Charles Johnson first met in 2004, they planned to spend forever together.
Kira challenged me to be a better person in every single aspect of my life.
They were overjoyed when they welcomed their first son, Charles.
He's so handsome.
Their second son, Langston, soon followed, delivered through a routine C-section after a healthy pregnancy. It was April 12th, 2016.
Hey, Langston.
Their celebration quickly turned to concern, though, when Charles noticed blood in Kira's catheter. He alerted doctors, but says minutes turned into hours.
I'm begging, I'm pleading for them to do something.
Finally, he says, after 10 hours, doctors decided Kira needed surgery, but it was too late. Kira hemorrhaged to death. She was 39 years old.
Never imagined that I'd be sitting here today and that we would have left that hospital without my wife.
About 700 women die each year in the U.S. due to pregnancy or delivery complications, and African American mothers are 4 times more likely to be victims than white women. Dr. Valerie Montgomery Rice says the causes of racial disparity aren't fully known.
I definitely think that there is a level of unconscious and conscious bias that occurs in medical settings.
Charles Johnson has turned his tragedy into action, helping to pass the Preventing Maternal Deaths Act, which became law last year. It requires states to review every pregnancy-related death. Charles' other fight, making sure his boys remember their mother.
The toughest question my sons have ever asked me is Mommy mad at me? Well, why won't she come home?
His answer, Mommy is in heaven and loves you forever.
I think Kira's legacy will be one of being able to show people that regardless of the circumstances, that love always wins.
All right, so really just taking a breath and a pause as we're thinking about Kira Johnson, and not only Kira Johnson, but also other Black mothers that had lost their lives to maternal death. And we talk about mothers that lost their lives, but then also mothers that have experienced near misses or near death experiences. We have to really just pause and reflect. And as we continue to reflect, just actually to take some time for yourself. I know that we'll talk about some heavy topics. And so if you need to step away for a moment, or if you need to take a breath, you need to take, you turn your screen off for a moment, that's okay. We know that we're unpacking a lot of heavy topics today. But as we look at this next slide, we do see Kira's beautiful face here on the right-hand side. We also see moms that have lost their lives, very similar to Kira's story. At the top left-hand corner of our screen, we see Amber Rose Isaac, her son and her father of her child, who lost her life. She was in the hospital and she had to tweet and to say, I can't wait until I get out the hospital to tell about the injustices and what I'm facing. Underneath of this picture here, we see Shalon Irving, another mother that lost her life right here in a picture frame, which she should be here with her child. Her mother just really sharing and advancing her story and amplifying her story further. Shalon was a lieutenant in the US Public Service. She was an epidemiologist for the CDC. And Amber Rose Isaac, she wanted to open up a daycare that had art therapy for children. And as we heard from our story here with Kira Johnson, she spoke over 5 different languages. She loved to travel. So I say all this to say that these are women that reflect myself, that reflect us, I'm sure, women that are bright, that have, so much on their lives that they need to live, and loving, caring women, even go-getters, I would say. And just thinking about Kira's story of how she was unheard for 10 hours. That should not be, that should never be, of someone waiting for 10 hours of care. So as we're looking at the next slide, I want to hear from you all and just have a short discussion. And my discussion question is this: the US is both the most dangerous and the most expensive country in the world to give birth. What do you believe needs to change? So you could take yourself off mute. You can put your answer in the chat. And Sora Dewana, if you would help me with this too, might need your help. But I just want to take a moment to reflect and think about how should Black women be treated, dignified, and cared with respect, and what needs to happen in the US. And we could even say New Jersey specifically. So I want to see you in the chat right now. Feel free to pop in. And if you don't mind, I'm just going to read a few of the answers I see in the chat right now. Sora Tillman, it almost happened to Serena Williams. Absolutely. Serena Williams and Beyonce had issues during their pregnancy. And that just shows us that no matter your economic status, where you're from, how much money's in your pocket, your status, it does not matter. It could happen to any Black woman. Kim, if you don't mind me reading this back, Sora Kim, that you're crying right now. It is very emotional. Thank you for sharing that. Yes, we need to be heard. We need to be listened to, believed. We need to acknowledge the conscious and unconscious bias in healthcare settings. Very powerful. Thank you, Felicia. Hey, Jury. The doctors of color who understand our needs. We need more of those, absolutely. So thank you all for sharing in the chat. I want to keep those conversations in that same space going as we are continuing to go throughout. And I'm looking forward to discussion a little bit later as well. But I will continue to push forward, but thank you for sharing that. So one thing that we see that is a reoccurring theme with the scenarios of Kira Johnson, of Amber Rose Isaac, of Shalon, Beyonce, and Serena, is that there's racism in maternal health. We have to talk about the past to know where we're going in the future, right? So when we're thinking about maternal health and how to make changes, we know that there have been systems of oppression and systems of disadvantages for Black people for centuries. And so what we're going to do now is shift and unpack that and see that how those impacts really directly relate to Black maternal health. So first I want to start with the definition of racism. And I won't give you a textbook or definition for this conversation or this context. What I want to do is share a definition from Dr. Kamara Phyllis Jones. She's a past president of the American Public Health Association, and she's also an instructor throughout the United States, and right now is practicing in Emory University out in Atlanta. And her definition of racism is a system that assigns value based on how one looks and unfairly disadvantages some individuals and communities. And it saps the strength of the whole society. And I really just pause and reflect on that last piece. It saps the strength of the whole society. Because when we think about racism as a whole, we're thinking about what we call a lot of times in the health sector as the social determinants of health, where we work, where we live, where we play, where we worship and grow. And so if racism is there, if it's present, then how can we be our best selves? How can our family be the most healthy and, the best quality care that everyone needs? How can we achieve that if that is in place? I also want to pull out another definition, and this is systemic racism. And as I just mentioned, there's systems of oppression, systems of pervasive and deep embedded systems, laws that are written, also unwritten policies that really just condone and perpetuate that unfair treatment for people of color. And that's what we'll be shifting and focusing on our attention right now. So as we look at a timeline and as we're thinking about how these things have impacted Black people historically, we have to look at stereotypes, stigmas, and myths. And so I want to highlight 3 derogatory icons that are labeled in Dorothy Roberts' book, Killing the Black Body. I do urge you, if you have not read that book, please do. It's really powerful as we talk about maternal health. And on this slide here, we see 3 different pictures represented. The first, if we go all the way to the left-hand corner of our screen, we see that this is a picture of Jezebel. And in the 1700s, Black women were known as a stereotype of being sexually promiscuous, as being bad mothers. If we look at the picture in the center, we see a picture depicted of Mammy. A lot of us know Mammy from, if we go back to the first parts of movies and written plays, Mammy was that person that was taking care of her master's children. She was always there from night till dawn, taking care and rearing up children and taking care of all household duties, but was still looked at as being inferior. And so Mammy, even though she had this wonderful responsibility of taking care of somebody's children and being responsible for all this, she was not able to take care of her own children. And because of that was looked at to be neglectful, was looked at to be a mother that did not care for her children. But it's unfortunate that she did not have the time or the quality time to take care of her children because she was enslaved. And then as we look at our last picture here, we're thinking about the 1900s and really looking up into our timeline of the welfare queen. Welfare queen was known in the 1970s, 80s to be that woman that was on public assistance. Stereotypes were said that she was unresponsibly getting pregnant and, all these different negative pictures and illustrations of Black women, which are not true. That Black women are, that should be empowered, that should be uplifted, we should be treated with care, dignity, and respect. So as we look at a historical view and continue up our timeline, I do want to go back to our enslavement period. So for 246 years of enslaved period, we're thinking about times of reproductive and sexual injustices that have happened to Black women, that the strong Black women, or we'll put in quotations, Black women that were strong, were those who were known as the breeders that were chosen. That Black women, about, I want to say 58% of Black women, it was known that they were sexually abused. And also thinking about how Dr. Frank Hoy Marie experimented on Black women in the 1700s and performed over 30 C-sections for Black women. Now, as we look at this picture in front of us, we're looking at a historical picture of James Merriam Sims and a slave or enslaved woman. Her name was Lucy. And James Merriam Sims, he's uplifted in so many medical communities, known as the father of modern gynecology. And he was the president of the American Medical Association. And he has all these accolades. But really, we have to take away those accolades. We have to dismantle those accolades because James Merriam Sims performed experimental surgeries on Black women without their consent, without pain medication, without any type of anesthesia for these Black women. And so they were treated unfairly. And he believed that Black women and Black people did not feel pain. And we know that if we go into the time of which we live now, that this thought that Black people don't feel pain is still in a lot of our white practitioners. It's still in a lot of our healthcare settings, where a study in 2016 said, do you believe that white people feel pain? Or excuse me, that Black people do not feel pain, that Black people have thicker nerve endings, and that Black people have thicker skin? And over 50% of those white medical trainees answered yes. And we know that that's problematic as we're thinking about the care and the best care for Black women. So our last slide on our historical timeline, we see slavery, Jim Crow, redlining, mass incarceration. We think about Black women, but we also want to think about how it impacts families as a whole. We know that there was the eugenics movement of women being sterilized without their consent, without them knowing. When we think about Tuskegee experiment, about Black men that were not treated for syphilis and were said that they had bad blood for over 40 years, we know that there have been so many impacts along the way for not only mothers, but babies and families, and it transcends and it perpetuates into our history today. So we're going to move forward and talk about the impact on birth today. And so when we think about going all the way from our historical timeline up until now, these are some of the trends that we see and that we are trying to dismantle and make change around. And the first is disparities around preterm birth and Black infant and maternal mortality rates. And so we'll dig into preterm birth in a bit, but with Black infant and maternal mortality, we know that we're at a state of crisis. As Sora Dewana mentioned earlier, that Black women in New Jersey are 7 times more likely to face pregnancy-related death compared to their white counterparts. And our second piece is families and birthing persons not being listened to. So if we go back to the stories of Kira Johnson and hearing about Shalon and Amber, really just saying the names of these women and letting it resonate, and women that we do know in our experiences as well. We know that many times that Black women have been unheard, have been silenced and disrespected in healthcare. And then lastly, underneath Black birth outcomes being impacted regardless of your income, education, and where you live. As we talked about, Serena Williams, Beyonce, it does not matter about our education, income, or where we're from. It matters really about the color of our skin, and that has to change due to implicit bias and explicit bias. I'm glad someone put that in the chat. So I did say I will talk about preterm birth. So we just mentioned about maternal mortality and maternal deaths, but I do not want to miss talking about Black babies as well, but just start talking about and having a conversation around New Jersey. So this is a map of preterm birth. And if you're unfamiliar, preterm birth or premature birth is a baby that's born before 37 weeks. So as we look at this map, it's very colorful. We know that the darker colors on the map here represent those counties that have the higher rates of preterm births. And why do I specify preterm birth so hard? I want to tell you that because it's connected directly to infant mortality, or a baby dying before his or her first year of life. In fact, that babies that are born preterm are 7 times more likely to face infant mortality. So for our project, we focus highly on Essex County and Atlantic County, because as we break out in the cities, we see that they have the highest numbers and highest rates of preterm birth throughout the state. And for our conversation today, I just want to take a minute to look at Union, to look at Middlesex and surrounding counties of where you live, and look at how it compares on the chart. And we'll kind of tie that into our conversation as we're talking about maternal health as well. So 3 big changes need to happen to advance equity. So when we hear these conversations and these stories, we want to know what can be done, right? And so 3 big topics I want to share. The first is at a policy level. So we know when we change policies, when we have our legislators on board, when we have our politicians on board, and those who are change makers, they can make the big changes that trickle down all the way for communities at large. So someone said it earlier, implicit bias training. And I'm glad that we talked about it, because there has been recent policy by the First Lady of New Jersey, First Lady Tammy Murphy, to include implicit bias training for anyone who touches the space of maternal child health. So that means if there's an OB, if there is a maternal fetal medicine specialist, or even the front desk staff, they will all be required to take implicit bias training, because we all have biases, but we have to keep our biases in check so that Black women could have the best care that they deserve. We also have to talk about paid maternity leave and extending that for Black women and all women. increase Medicaid coverage, and then access to care. And then from an institutional level, really thinking about community organizations. How can hospitals get on board? We just talked about implicit bias training. So how can we expand that out even further? We want to see implicit bias training not only as a one-time training, but we need to have it as a systemic training all throughout. So not just taking it one time and checking that box off, but continuing to have these conversations. And then lastly, we'll talk about this a lot today, which is what we can do at an individual level. So how can we center the stories of our own stories, of community stories and experiences, and how can we uplift and empower communities? We'll talk about that today. So before we get there with action, I want to talk about some ways that we can, form some action within our own self as it relates to centering wellness and healthy births. So to center health and wealthy birth or healthy births, there is so much that we could do on our own. And if we are not considering being pregnant or we're not expecting, et cetera, we can always share these wonderful tips with other mothers that we do know and other women in our communities. So first, I want to take a pit stop at chronic disease. And chronic disease, we know it to be a health condition or illness that lasts over 1 year that needs ongoing medical care. So I highlighted 4 different chronic diseases just for our discussion today. And the first is heart disease. And heart disease is the #1 killer of women all across America and affects Black women disproportionately, especially as it relates to maternal health. In fact, for maternal death, we also see cardiomyopathy and cardio conditions being the #1 killer of women. Next is high blood pressure. And high blood pressure is a condition of the amount of pressure that's pressuring or pushing on our arteries. And so when I'm thinking about high blood pressure, we talked a little bit about it in our introduction, that preeclampsia has its impact around blood pressure. When we think about pregnancy, preeclampsia is a condition that could happen during pregnancy or also after giving birth, that if you're experiencing any type of stomach pains or fast heart rate or headache, there's many signs and symptoms that we need to be knowledgeable of, because they can be something that can prevent death, because really it can be a severe disease and condition for pregnant and postpartum women. And then next on our list, we have diabetes. That's simply having too much sugar in the blood. But we know that that can also be problematic during pregnancy, if there's gestational diabetes, or if there's diabetes already present and are birthing people before pregnancy or during pregnancy. You could be more likely to have a stillbirth or a miscarriage or a preterm birth. So really just thinking about how to get our bodies in check and ready for pregnancy. And then lastly, we say obesity. I also like to say plus size, or maybe having some extra pounds. And this is also tied to high blood pressure and diabetes as well. So once again, when we think about having our healthy pregnancy, it really starts before getting pregnant, making sure that we're setting up appointments with our doctor, which are called pre-conception appointments, and making sure that we are having these conversations with those that we love in our community as well, so that we can have the healthy and best pregnancy as possible. And I can't have this conversation without talking about chronic disease, or chronic stress and mental health. So when we think about that, a lot of times we're thinking about the baby blues, or we're thinking about postpartum depression. And we know that postpartum depression and anxiety actually happens for Black women more than their white counterparts. In studies, we've seen that. And so it's definitely important to have your finger on the pulse of any signs of depression, high fatigue, extreme fatigue, hopelessness, or depression, all throughout pregnancy, but then also after giving birth. And if we're not the pregnant person and we have a sister or a friend or an aunt, whoever it may be, make sure that we're checking in on those birthing people as well. I also want to mention weathering. And if you're unfamiliar with the term, Black women, specifically Black birthing people, face a high rate of weathering. And what is weathering? The weathering hypothesis shows us that women who are Black, our bodies age faster than white women. And so a lot of times we're like, okay, what does that mean? Because Black doesn't crack, right? So we look good from the outside, but we have to take care of our inside, right? And so with weathering, we're facing these systems of oppression. We're facing systems of racism. We have discrimination, disadvantages that affect Black people all throughout their lifespan. And these stressors that are constant that women face is called the Weathering hypothesis and can certainly lead to negative or poor pregnancy outcomes. So that's why we have to make mental health a priority in our communities, and to make sure that we are talking to folks, that we are going to support groups, or we're having therapy, any type of stress reduction activities that can help to have a healthy birth. So I want to say empowered pregnancy and birth. And I really love this term because we have the power. We can really put that in our hands to make our birth and our pregnancies the best as possible. And so I have a few pictures here and I'll just go through. We can definitely eat a nutritious diet. And I want to just mention and highlight if there's ways, if you don't have too much of those good green and those wonderful fruits and vegetables in your community, I encourage you could try to grow your own vegetables at home. We had a project last year where we had a community garden help us to grow these container gardens inside of our own home. So I don't have a garden space in my apartment area, but I can definitely grow some microgreens and some wonderful lush vegetables inside of my home. And next to this picture, I just talked about this a bit, but stress reduction activities. And one I have here in the picture is yoga. We also love meditation, journaling. Any way that we can help to take down that level of stress can lead to a healthy pregnancy and birth, and can also help to avoid or help to have a healthy pregnancy. And then down here on our left-hand side of the corner, I just talked about this too, making sure that we are talking to our doctors, our providers before getting pregnant, having those preconception appointments, extremely important. But not only for the mother, but it's also important for partners and fathers to get into the doctor's room as well. We see that when fathers and partners, mothers are going to the doctor before pregnancy and preparing from a preconception standpoint, that there's studies shown that there's a healthier birth that can help it happen and exist. And then lastly, in the corner here on the right-hand side, I have the woman that's journaling, that she's writing something down, but I'm thinking about a lot of things in this picture, that writing down your birth plan. So if you are pregnant, what type of deliverables do you want? What type of care do you want? What are your wishes for your pregnancy? So making sure to make that clear with your provider. Also thinking about what type of questions you might want to ask your provider. So if it's your first time getting pregnant, or maybe even your third time getting pregnant, you want to write down the questions that are important for you to share with your doctor. And I would say do not leave the office until you get your questions answered. Make sure that you are getting everything that you need and that you want to know. And I also say, that's not here on this picture, really having a doula present or a support person that will help you through your pregnancy. Doulas have also shown to have better pregnancy outcomes for women that hire or that have doulas on their team. So make sure that you have a team, or I also like to say tribe, people that are there for you during your pregnancy and after you give birth, extremely important. So I'm going to shift gears a little bit, and I said I would talk about our program, the Prematurity Prevention Initiative. So I'm going to tell you who we are. So the Prematurity Prevention Initiative is a collaborative effort. We are here to lower the number of preterm births throughout the state of New Jersey. We know that 1 in 10 babies are born early, and it's at a state of crisis. So we're here to help with any strategies and resources that we have. So on this next page, I'm just going to go through a few pictures I like to share, and please feel free to contact me afterwards. I would love to share some of these resources if you like to share them yourself too as well. Here at the top, we have a picture of the NAACP Black Infant and Maternal Mortality Task Force. And this task force is comprised of those from the NAACP, those who are educators, political leaders. We have lawyers and doctors and all different types of diverse membership on our team. At this time, we do have a task force in Atlantic County. We also have one up in Essex County, and we're forming one in the Central region. So I'm going to tell you a little bit more about that towards the end, and I would love to have your help with that. You might have participated and saw this flyer here. So during Black Maternal Health Week, we screened a viewing of a really powerful film. It's called Toxic, A Black Woman's Story. And we had a great panelist full of doulas, who I just mentioned. We had an OBGYN as well as Jay Wilson from Melanated Mom. So if you did not see that, I encourage you to look at our YouTube page and take a look at that. It was a really powerful discussion. We do have trainings as well. So we have trainings quarterly called Power of Our Voices, and you're all invited to attend. We have one coming up in June. This training is a 2-day free training. It talks about Black maternal health, some of the racism and the stigmas and the implicit bias, and what can we do and some strategies that we can put in place. And I'll be sharing a new flyer and some information when it comes up, but look out for that in June. Also, PPI, we have a medication called 17P that we distribute to moms that are at risk of having a preterm birth. So we have plenty of this medication. So if you know someone who had a previous preterm birth, this can help to lower their risk. Then lastly, we are here for all the NICU parents, of course. So we have these wonderful little NICU bags that we're giving out starting this year. So if you know any parents in the NICU, we would love to provide these bags to these parents. We also have some toolkits available. So if you are someone that is on your phone, if you are on your tablet and you love to share online, this will be perfect for you. We have 2 toolkits available. One is called Watch Me Blossom. It takes 39 weeks to bloom. And the second one is Black Infant and Maternal Mortality Toolkit that was created in collaboration with the NAACP. In these toolkits, you'll find information on Black maternal health. You'll find education about Black infant and maternal mortality, but then also, how can we change this as a community? How can we shape and change this as a culture? What can we do to face these disparities? So once again, I'll share all this information with you afterward, but I would love for you to take a look at our website and to download our free toolkits. One of the last resources I want to share underneath our umbrella is a really powerful tool that we released last year. It's the Maternal Experience Survey. This survey is exclusively for mothers and birthing people in New Jersey. What we did is we created a survey with the NAACP, really helping and supporting us throughout the whole process. And we thought it was so important, just as we heard Kira Johnson's story, and as we know the stories of our own selves, that there's power in our voice, that there's power in our story. And so how can we get this and push it forward and amplify our voices? So the survey was created to gather the experiences of Black and Brown moms. It's confidential. You get to share as much or as little as you like. It's available in English and Spanish. And it's for women that had any type of pregnancy experience. So if you had a live birth, a stillbirth, a miscarriage, a termination, it's for any of those experiences. And we will give a free virtual gift or digital gift to anyone who completes the survey. Now, what we want to do is not just gather the voices and these experiences from Black women, but we also will share this out with hospitals, with healthcare systems to make some change. We know that change needs to happen as we hear about these stories that continue to perpetuate in healthcare systems. So as we're making change, we'd love to hear from you. And if you have any questions, please feel free to reach out to me, but here's the link to the survey right here. Last thing about the survey is that you probably may have saw this on our social media pages if you follow us, but we do have some really wonderful women that wanted to share their story even further and publicly. So Naomi, she's from North New Jersey, and she said, I had a hard time understanding why my baby had to stay at the hospital. She's a NICU parent and really had questions around why this had to happen to her. And then we had Danica. She's a mother also from central northern New Jersey. And she said, when I left the hospital, my blood pressure still wasn't controlled, but it was time for go. And for days and weeks to remember, I felt so much anxiety and so much panic. So what we really want to do is to build a community of moms that have these stories. We don't want moms to be siloed or to be in corners anymore where they feel like they can't share their story. And so the Maternal Experience Survey gives a voice and a place and a space where Black women specifically can do just that. So my last slide today is really some actions that we can take to move forward. And the first is to collaborate with organizations to address communities impacted by maternal and child health disparities. So what does that look like? there's so many different organizations right now that are having the conversation, and I love that. I love being here today to talk about it. If you would like, I will give you more information about our Central Region Advisory Board that we are building. We need all the voices, all the experiences, anything that you could contribute. And so that's coming up next month. That's one way to definitely get involved. Another piece is advocating for policies that support accessible maternal health care services. And those services might be doulas, as we mentioned, those support people to help women through their pregnancy and postpartum. We talked about mental health, how important that is for birthing people and mothers. And then also lactation resources. If women choose to breastfeed, or if they don't choose to breastfeed, what do moms need to know? So we need all these services in place. Next is educating community members and colleagues. And how can we do that? In so many different ways. By just sharing the book that I mentioned earlier, Killing the Black Body, or going to our toolkits on PPI's page. There are so many different outlets to share, especially in our digital age. So I encourage you to share with your colleagues and your community members and family. Also knowing the services in your community. So I mentioned about the Southern New Jersey Perinatal Cooperative as being a part of the Maternal Health Consortia, but throughout the state, you have other maternal health consortias, and we have March at Dimes, and we have so many different wonderful organizations that are doing the work. So make sure to know the services in your community for yourself, and then also referring them to other folks. And then we talked about it today, prepare to have an empowered pregnancy and birth. So a healthy birth. How can we manage our chronic disease and prevention? We want to exercise. We want to do some stress reduction, eat as best as we can, write down our birth plans and our wishes and our wants. All these things are extremely important to have a empowered and healthy pregnancy and birth. So I want to say once again, thank you all for this space and for this time. This is my information. I'll make sure to share this with all of our members here. And I thank you, and I'll pause for any questions. And I know me and Trayshawn, we're going to have a great conversation too, but thank you all again.
Thank you so much, Christine. I have so much I want to talk about, but I know our next thing is a conversation with you and Trayshawn together. So I will leave it to you all to kind of continue the next part of our program today.
Thank you, Dewana. And for our participants, please feel free to put your information in the chat. Also, any questions that you have. Thank you, Christine, for raising Kira Johnson's story, for raising stories across the nation. And I want to pause and also note Johanna Jimenez of Patterson. I want to note Tahisha Dickey of East Orange. And I also want to note Trayshawn Powell of Somerset. And the reason why I say those names, Joanna Jimenez died giving birth after 3 days. Taisha Dickey died in childbirth. Trayshawn Powell was near death pregnancy. So you may ask, why do I raise myself? I raise myself because I'm here to share the stories, right? I was diagnosed as having HELLP syndrome at 23 weeks. My daughter, Mia Jane, was born. She died 3 days later after me giving birth. I was in the ICU for 2 weeks after going through multiple surgeries. I had my liver hemorrhage. And so I share that here in this space, is that there are national stories, and there are stories of people who may not share with you. And the reason why I share this within this space is because at that time, I didn't have a community that reflected me to lean on. I had allies that had this experience to happen to them, but I had no one, specifically a person of color, that I can go to and say, hey, have you had HELLP syndrome? What is that? What does it look like? And so I say that to say is, how, Christine, would you say that we can impact our communities? How can we talk to our girlfriends? How can we talk to our sisters, our sister-in-laws, our sorority members about the impact of pregnancy? And so I think that sometimes as mothers, as daughters, as friends, our parents tell us, hey, go to college, get a great education. You go there, you meet a fine brother, and then you want to get married and you say, hey, let's settle down and have a child. No one thinks that when that happens, the first thing that happens is death. And so I share that because that's what I was told. That's what I did. And our first child died. And so now I share that to ask, like, for you, how would you share with your friends and your communities about the impact of birth?
Yeah. Well, first I want to say thank you for your transparency and sharing your story. And I know that it's not easy. You know, it's not an easy thing to just share something that was such an impactful portion of your life. And I appreciate you having this conversation today. I think there's so many different ways to share right now. And I agree that really when we look back at childhood, sometimes our parents said, well, don't share this. Or I know in certain communities it might say, you know, kind of keep it to yourself, or you know, don't share. And it's so more important than ever to share our stories. As I mentioned, there is power in your voice. And I don't want to underscore that at all. It is something that needs to be uplifted so high right now, because we know that just sharing a story, it might have happened, you might have had a similar experience, or it might not have happened to you at all. But when you hear these stories and when we could share and we could amplify these voices, that means that we can pass on these stories, and we can pass on these experiences, we can pass on these learned lessons and share it to other generations to come so that it can transcend and it can move forward. So I would say sharing it with your girlfriends, sharing it with your friends, coworkers if it's appropriate, really in any type of parent forums is really great. And I think on social media is really wonderful too. There's so many different parent groups, so many communities that are being built right now, and Facebook groups and so forth. So I would just say share your story. It's tough, it's hard, but it really is benefiting, you know, communities and women to come when you do.
Thank you. Christine, you talked about advocating for change. And I think sometimes as women of color in communities of color, we're not taught to use our voices, to ask questions to our healthcare providers. Healthcare providers come into, we all have been in the doctor's office where a healthcare provider comes in, they knock on the door, they're with you for 5 minutes. And sometimes some people may feel dismissed, or they just don't feel that they have the time to spend with their doctors. Are there any tips that you can share with us about engaging ways to talk with your healthcare providers about the necessary steps to take preventative measures?
Yeah, absolutely. I talked about this a little bit in the presentation, but having those questions prepared that you want to ask your provider is really, really crucial, I would say. So if you go on our website, NJ Preterm, we have questions already prepared that you can ask your provider. This is for all women across the board. We also have questions for NICU parents as well that we really were intentionally thinking out and thinking through. And we have questions specifically if you are a Black woman, if you are a woman of color, there's certain questions that you need to ask, because we know that we're dying at a higher rate than any other counterpart out here. So we do have questions available. So that is a resource for you. But yes, have the questions prepared, have them ready. And as you are asking questions and as you are kind of interviewing and getting to know your provider, if you do not feel comfortable, if you feel like you're dismissed, if you feel like you're unheard, it is okay to get a second opinion, or it's okay to move on. And I think that's important to say, because a lot of times we think we have to sit and take it. And if we say something, we're going to be the angry Black women or all those things. So making sure that we know that we can have an empowered birth, that we can have the birth that we deserve. We are, what is it called? A shared decision making. We are the person as a collaborator in our birth. And it's important also that we have to be known as we know our bodies the best. No one else can know that for us, right? So I think that providers need to know that, and that's where implicit bias and all these type of respectful treatments come in. But absolutely, just making sure that you have all this information that you're armed with. Lastly, also having a support person. So if you feel like you're not the voice, having somebody at those appointments with you, like a doula, that can help to ask some of those questions that you might be unsure of, or to be that second voice when you might, have yours a little bit lowered or not really too sure what to say, or maybe unable to share at that time.
Thank you. You also talk about having a support person like a doula or a birthing person. Yeah. For our friends and people who are not in this field of maternal health and public health, how does one go about learning the importance of a doula, or learning the importance of a birthing partner in the hospital and out of the hospital? And the reason why I ask that is because when a birthing person is in the hospital, they get all the care that they need while they're there. But we know that statistics show that upon exit and they go home, they may lack some of those supports. So how would you talk about, the importance of getting that, and how to get that, and how to even start the conversation?
Yeah, absolutely. So first, to back up and share, because I didn't really outline this in the presentation, but a doula is a support person that helps you during your pregnancy, They can also help you after your pregnancy. So there are different types of doulas. There are some that are full spectrum that cover every and anything, but there's some that have dedicated categories, if you will, such as a bereavement doula. So if you did experience a loss, there are doulas that are there to support you in that time of your loss and bereavement. So I think it's extremely, extremely, extremely important to have a doula on your support team, on your support side, or as you heard me say, your tribe. Why it's so important is because, as I mentioned, just about your voice. If you are not sure, or if you are not able to speak, and maybe you're in so much pain, or whatever the case may be, your doula is right there with you, to be there with you at your appointments, to be at the birthing. At your birth. They're there throughout the whole process to make sure that your voice is heard, that your wishes are carried all the way through. And that's why they're so important. They're also there not to give medical advice. So they're not a nurse or a doctor. Usually they're a person, a community person, but they're there to support you. They're there to give you some tips. As we talked about the exercise and eating and nutrition, they'll help you with that. They'll help you with anything you need. And I know actually some doulas prepare, some food and do meal prep. So they are there for you all throughout the process. And if we think about going back to our history and ancestry and all the way back to, Africa and Caribbean cultures, this is what was happening. We had doulas and midwives throughout the whole process. And so we see that better birth outcomes definitely occur when a doula, or when we have that support person right there along the side with us, that's advocating for us. And that is really just our person, our person that's there for us throughout the whole pregnancy and so on.
Thank you so much. And last question before I open it up to the participants is that as we talk about the importance of Black maternal health, as we see throughout the nation and the state, Black women are dying at record numbers, and we see the statistics and we hear the names. For our participants, if we struggle with infertility, or we struggle with even wanting to get pregnant because of the stark news and the names that we see out there, what are some tips that you can provide to our participants that lets them know that you can have a successful pregnancy, or any tips you can provide for any of our members that may struggle with infertility or may just not want to get pregnant because of the news that's out there?
Yeah, really great conversation. And I'm glad that we're having this one too, because I feel like there's so much stigma around loss, or around not being able to get pregnant. So it's so important to talk about this. So I would say healthy ways, or ways to achieve pregnancy, that are those healthy, empowered tips that we talk about. Just to reemphasize a couple of them, we want to get our chronic diseases under control, or if you're, let's say, pre-diabetic or things of that nature, just making sure that we are taking the time to take care of ourselves, right? Whether that be through exercise, whether that would be through some yoga and some meditation, getting a therapist, whatever we need to do to get ourselves right is particularly important as it relates to infertility. We know that with infertility, if you do have chronic disease, that those numbers or those occurrences can be, they're very correspondent, they're very congruent, they're together, they melt together. I also mentioned this a little bit earlier, that we need to make sure that fathers and partners are on the same page. And so why is that important? Because they are half of the equation. So it's just as important when we talk about infertility for our partners to be healthy as well. So making sure that when we're having these appointments and we're talking to our provider, that they're right there in the center of things too, because we need to make sure that they are on board and healthy and living well. I would also say to look at some of these forums and these conversations out here. There's so many Black women that are having these conversations around infertility. There's a podcast that I'll leave you with that's actually from Northern New Jersey and New York. That's really wonderful. And I know Therapy for Black Women just had a really great show about this really recently as well. But there's so many different ways, and if you're not ready to have a child right now, that you can freeze your eggs and you can freeze embryos. So I just want to say, if you're not interested, or if you think that you might be interested, you're on the fence, look into these other possibilities, because it's not just a black and white situation. There's some gray area in there too that gives you some freedom to, if you're like in your career, or if you are saying, hey, I want to wait 5 years, that's okay. There's different ways, there's different options for the future for you.
Thank you, Christine. Thank you so much for this dialogue, for this conversation. It was very timely. And I want to pause and open it up to our participants, so please feel free to take yourselves off mute if you need to. Place your questions in the chat, and I'll turn it over to Dewana Graham. Thank you.
Thank you. Thank you both. So I've been monitoring the chat. And so if you have questions, definitely put them in there. I am aware that we are running a little bit over on time, but we do think, and it's a really important conversation. And I think while we have the benefit of Christine and Trayshawn with us, you know, we do want to still hold some space for people who may need to ask a thing that you haven't found a place to ask before this moment, or to share a thing that has occurred to you. So so definitely give it a minute to see if anyone has anything. But I think while we process that, what was so, at least for me, kind of impactful and personal listening to the conversation, it really, Christine, when you introduced the concept of weathering, and that was new for me and it was unfamiliar, but as you were talking about all of the different things and the definition that I kind of wrote, you know, I wrote what you said, but like I heard that as like, it's just the internal unseen impacts of the cumulative lived experience of being Black. Yeah. And how that just sits in you in ways that we're not always paying attention to, we don't know, but it just manifests itself in so many parts of our lives. And I think the more that we give ourselves grace and permission to really lean in and start doing that unpacking, it will just be transformative for us in so many ways and start to give us the confidence, the language, the whatever, to become better advocates for ourselves, better advocates for our communities. And so I think for me, there's lots I will take away from this, but that is definitely one that just really resonated with me.
Absolutely. I'm glad that you brought that up. And I will give a nod to say that research to come up with that hypothesis actually was in Jersey, in Trenton, actually. And so you're right. I love the definition that you just gave. I don't think it could say it any better, but it is like those internal oppressions, if you will, that come up all throughout a lifespan of just being Black in America. There's so many different dismisses and discriminations and prejudices that we face on the daily that we kind of like keep it moving and we keep it going. But as you said, Sor Dewana, if we can unpack some of those things, it can definitely help to de-stress us. I will also say another different hypothesis that's out there is the strong Black woman hypothesis. And I think a lot of us can relate to this, of being the matriarch of your family, of being the sole caretaker, or that person that gets everything done, or that hard worker, etc. And so that can definitely have a wear and tear as we're talking about mental health, as we're talking about weathering. All those things once again melt together. And so really just unpacking and taking the time for ourselves to do what we need to do for ourselves to be the best and healthy version of us.
I do see Madam President has her hand raised.
I just wanted to first thank our speakers for just a great conversation around this, but I just have a reaction to build on what Sor Christine just said. And I think for me, what's resonating is it's really tough out here in these streets for us as Black women. And she beautifully and succinctly and artfully described the history of all that we carry relative to our, maternal and infertility or journeys. So I just would challenge all of us to lead with some radical empathy as we interact with each other, because the world is doing enough to us, right? Around these conversations. And just be mindful, if you're struggling with getting your kids to soccer practice, that sister sitting next to you could be struggling to get pregnant. If you are, or she may not be able to get pregnant at all. You just don't know. And so I would just challenge all of us to give ourselves grace and each other's grace, and practice more intentional empathy as we have conversations around our maternal journeys as women, because all of us are in different places. Some people, can, have babies left and right without a problem, and other people can't. And there's all kinds of shades in between. And so just as we were talking about solutions and what we can do as action items, that's what was coming up for me, just to lead with empathy, grace, and sensitivity, because you never know how what that other sister is going through.
Thank you so much, Madam President. I wanted to just add with that is that's why these important conversations are so much needed. That's why conversations with your friends, conversations with your community, conversations with your coworkers, just because of what Madam President just said. You don't know who's sitting next to you who may have gone through that experience. I share my story because of that, right? I think about the stats, the 1 in 5. It was 5 of us pregnant in 2013. 4 of them had successful pregnancies, and it was me, the 1 in 5, right? And either I could have taken that information and then wallowed in my grief, which I did for quite some time and not shared, or I used my voice to advocate for change and spoke to my family. I educated my family about preeclampsia and HELLP syndrome. I'm educating communities about preeclampsia and HELLP syndrome. It is very important for us to be able to use our voices. It's important for us to be able to engage our family and our friends about the dynamics in the hypertensive disorders of pregnancy. It's on us to be able to share that information, to lead with that information, because we are dying at deathly stark rates. We have to have the conversations, and it has to start with us.
Thank you for that, Trayshawn. So I see just from the comments, lots of people, you can read them for yourselves, but, excellent presentation. And I think we're all just really recognizing the importance and the power of why these conversations are important, and the need for all of us to continue this dialogue. And, whatever our story might be in this journey, getting more comfortable having those conversations. Because it really, I think, is that visibility that will ultimately get to the greatest impact for all of us. Christine did also drop a link to the New Jersey preterm social media and the information. I did kind of capture all the different links that we've talked about, so I will pop all of those in the chat, from New Jersey preterm to, in our opening comments, Madam President talked about some upcoming activities and events that we have. There was one we did not mention, Trayshawn's Promise Walk, so I'll also put the links for that in here. But I think, before I turn it over to Madam President for some closing comments, I think what I would leave all of us with in the conversation today is, we are a community, and if we can't take care of each other, no one else is going to do it. So thank you.
Amen. 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 And thank you, Sora Dewana, for your vulnerability and your leadership today. And I just want to close by saying, you just don't know. You don't know what your sister's going through or what she has been through. So let's all be mindful of how we talk about these certain issues and things of that nature. And it could be very innocent. I'll share this myself. The other day, I was having a conversation with some coworkers, and they were all talking about cravings that they had during their pregnancies. And so I wasn't saying anything. And so one of them put me on the spot and just asked me point blank, well, what did you crave when you had your 3 kids? And I was like, my 3 kids aren't biologically mine, and I didn't want to go into my whole, fertility challenges and journeys and all of that kind of stuff. But it was led to this very awkward silence. And I just say that just to say, you just never know. I mean, I was fine with the conversation and it wasn't a big deal to me, but that's me. And based on how I've processed my own journey in this particular space, other people, it's devastating. Other people are struggling. You just don't know. And so something as mundane a conversation as that I literally had it in the elevator with some colleagues of mine could be devastating to somebody. You just don't know. So again, the good news is that there are resources. The great news is that we are a community. The amazing news is that there are people like Trayshawn Powell, like Christine Ivory, and like Phi Eta Omega, who do forums like this and have information and have resources. There is support out there. You are not alone. And I think we should celebrate that. And we have to be brave enough to be there for ourselves and for each other. So I really, really encourage you to lean into the opportunities. Christine just put into the chat about joining the Black Maternal Health Advisory Board for Central New Jersey. Her email is civery, so it's CIVERY at FHIWORKS.org. Get involved. I can't imagine the devastation that husband must have felt, that Kira's husband must have felt, but that gave him new purpose and he got inspired. He turned his pain into purpose. So, if that's you out there, here's a great opportunity to turn your pain into purpose, or it might be a different purpose, right? Or if you're not, and you just want to be there to support another sister, through her challenge or her pain and her process, get involved. And if you don't know, please contact our speakers. Christine, can you just one more time put your contact information in the chat? And Trayshawn, would you do the same for your organization as well? Because I want people to have the information and to get the support that they need. We will be making the replay of today's workshop available so that you can go back and redigest Christine's slides and all the information and resources that she shared. So the great news is that if we can leave you with anything today, is that you're not alone. You have a tribe, like Christine says, you have a community, and we are here for you, and we can get you connected to the right people and the right resources. You do not have to go it alone. And in our sorority, we use the phrase, we help each other. And that's something very meaningful to us as Alpha Kappa Alpha women. And in turn, we help the community in service to all mankind. So I just want to thank once again our first Vice President, Dewana Graham, and the entire program committee for putting together today's event for us. And I want to give special thanks to both of our panelists, Christine Ivory and Trayshawn Powell, for doing such a great job. And Sora Trayshawn, I want to thank you especially for sharing your story. I know it takes courage to lean into that vulnerability, but there's power in that too, because through your example, you inspire others to lean into their power and turn their pain into purpose as well. So thank you for that and all that you do. And last, but certainly not least, I want to thank every single person that's here today. You could be anywhere else right now, but you chose to be here. And I hope that you, like me, are inspired by today's conversation, strengthened by today's conversation, and affirmed by today's conversation, knowing that wherever you are in your journey, that you have a tribe. We're here. Phi Eta Omega is here. And the organizations represented on the phone, on the call today are here. You don't have to go it alone, and it's okay. It's okay if you want to cry, if you want to yell, if you want to scream, if you want to shout, if you want to celebrate. It's okay wherever you are. It's okay. Your journey is your journey, and we're here to support you and however we can through it all and connect you with the resources that you need. So. Again, Trayshawn has put her Instagram in the chat and her email in the chat. She's on Instagram at Team Mia Jane. She's on Twitter at Trayshawn. Her email is trayshawnpowell@gmail.com. Please reach out to our panelists. And again, once again, if you want to join the Black Maternal Health Advisory Board for Central New Jersey, please contact Christine Ivory at civery@FHIWorks I'm sorry, at fhiworks.org. Again, that's C. Ivory at fhiworks.org. So with that, everybody, have a wonderful, wonderful rest of your day and an even better rest of your weekend. Thank you so much for being here. And like the theme music said at the beginning, keep living your life like it's golden, okay? And have a great rest of the day. And thanks everybody for being here. Bye-bye.
Thank you.
Thank you.
Bye. Bye.